4 countries, 4 different cures for COVID. Today we examine the different ways in which Sweden, Italy, France and the UK are tackling the pandemic. Does anyone have the right answer? This is Roundtable. Welcome to the programme with me, David Foster. Lockdowns, masks, schools closed, schools open, curfews, protests. It is a confused response wherever you look across Europe. As the second wave of coronavirus cases hit Europe, many countries now face new lockdown restrictions. A month of tougher measures is coming into force in England. France has begun a second nationwide lockdown to last until at least December. Germany imposing a 1-month partial lockdown. Spain's regions announced restrictions on movement in the hope of avoiding a new lockdown. Italy has new lockdown rules, including the 6 p.m. closure of restaurants and complete closure of some businesses. The measures in Italy have been met with violent protests on the streets. As coronavirus cases continue to rise, are tough lockdowns the answer in Europe? Okay, on this round table, we are about to work our way around Europe. In the spotlight soon, France and the UK, but right now to Sweden. And Stefan Swartling, Peterson, Professor of Global Health at Uppsala University. After that to Rome and Dr. Flavia Riccardo. We'll see her in just a moment. Stefan, great to have you on the programme. Since your speciality is global health, you've looked at what other countries have done. So tell me, how different has Sweden been?
I think we're making sometimes a bit more of a distinction than what is justified. Sweden has actually implemented various measures that aim to isolate people from each other and reduce physical contact. I think the remarkable difference is that Sweden has not really put out a general recommendation for face coverings, but otherwise we are actually in many respects similar. The other big difference is that we've kept primary schools open throughout. So those are the two distinguishing features I'd like to point out.
Is one of the main differences, though, that Swedish people have done this voluntarily without the need to be forced or coerced? They've kept themselves to themselves, whereas in other countries they've had to be told and perhaps fined.
That's true. Sweden has a tradition of actually informing people and counting on people's trust, and to some extent neighbor policing as well, to enforce that, rather than actually doing government enforced measures and fines with that control apparatus. So yes, by and large, we have trust, and the idea is if you inform your citizens enough, they will comply.
You know, you talked about it perhaps being falsely held up as the paragon of pandemic virtue in the way that it's handled in Sweden. I've read various articles that say actually the death rates are pretty bad in Sweden comparative to some other European countries. So why do you think that is the case if Swedish people have kept themselves to themselves as much as they have?
I think the death rate we actually accumulated in the spring, in March, April, May, and that's when the corona got into our nursing homes. And our nursing homes were, I would say, a disaster waiting to happen, whether from corona or from some other measure, because they're underfunded, uncoordinated. And then in the midst of a heated pandemic, when there was a shortage of personal protective equipment, and we sent underpaid and unprotected workers to work in nursing homes, it was a disaster waiting to happen, unfortunately.
So what is the situation right now?
Well, I'm just from listening to the Public Health Authority's news conference, and large parts of Sweden are actually now enforcing various distancing measures. And I'm just about, as a university professor, to tell my students that I'm going to run the rest of my master's course this month on fully online, and we shall have no face-to-face. So wherever you can, we're encouraged to work from home. Primary schools are still open. You can still go to do your shopping, etc. You can't go to the theater. More than 50 people gatherings, etc. are banned. So we are enforcing stricter measures over Sweden generally.
But let's go back to something you mentioned, I think, at the beginning, and that was masks, not compulsory in any circumstances in Sweden. If that is the case, why have the authorities made that decision?
I think the authorities have looked at the evidence, and the evidence, although as it's starting to weigh up, I would say, as a global health professional, on the benefit of the masks. But I think we can agree that the mask is not the one thing that can control this pandemic. It's one of a handful of measures, along with physical distancing and hand washing and working from home, etc., that are truly effective. And I think government has still kept saying, or rather the public health authority, that the evidence doesn't really weigh up. I think there's no reason actually for masks to be used when you're by yourself out in the nature or wherever. But personally, I've made a decision that when I'm on a train or I'm in a crowded environment, I follow WHO's recommendations and wear a mask. But that is not yet the recommendation of the public health authorities in Sweden.
Has Sweden perhaps been a little bit geographically lucky in that it is not an international business hub in the way that London, Paris, Berlin, and Rome are, with many different nationalities flying in and out all of the time? Therefore, not so many chances for the disease to come in.
I would say that could apply now, but when this epidemic started out, we were actually quite unlucky in that Stockholm and a few metropolitan centers had the winter holiday, and just about every other family had traveled to northern Italy to ski or to London or to New York or someplace, and came back at the time of the outstart of the epidemic with a massive infectious dose. So that got us started, and I think that determined a lot of the early trajectory. Right now, I think I could subscribe to what you're saying, but not for the first wave, if you will.
Forgive me for asking you not to go into too much detail with this next answer. It is simply a matter of time. But is there any country you would look at and say that is absolutely not the way to do it?
I would like to say that the countries that have closed down primary schools without any evidence and refuse to open them, and the countries that open pubs before they open schools, that's definitely not the way to do it. Because if there's one big loser in this epidemic, it's the children of this world that are actually getting to be made to pay the price for an epidemic that doesn't really primarily affect them.
Thank you so much, Professor Stefan Swartling Peterson out of Sweden. Thank you. Well, for the second part of our journey around Europe, we head to Rome. We say hello to Dr. Flavia Riccardo, epidemiologist at the Italian Health Institute of Public Health. Italy, of course, Flavia, so very badly hit at the beginning of the pandemic. How have attitudes changed since then?
Well, certainly our people have had to learn the hard way what COVID-19 really was, and we had to learn it fast, and particularly its ability to overwhelm health services, which is something which then impacts on also other diseases and the needs of people. So definitely there's been a very tough wake-up call at the beginning of the outbreak, but this is a very long emergency. So I think now the concern is about keeping awareness high, people's risk behavior appropriate, even in this time in which unfortunately the epidemic is surging again.
Do the lockdown laws, rules, if you want to call them that, vary from region to region?
Well, during the first stage, we had some national measures from the 11th of March. So, blanket lockdown was the approach. Then, when we had our transition phase, and unfortunately, the number of cases went down, we used that time to build up our preparedness. And so, we developed a risk-based approach, which is region-specific. Because what became very clear at the beginning of the outbreak is that not every part of the countries was hit in the same way. And of course, it has to do also with resilience of services, how you react. So it's a combination of national measures which apply for everybody and also specificities that have to do with the epidemiology within each region.
Yeah, but I'm also wondering about rules chopping and changing over the course of the last 8 months. There is a certain demoralizing inbuilt fatigue in societal fatigue in that. Have you seen that in Italy?
Oh, yes. I mean, it's definitely complicated. And I think the most difficult thing about this pandemic is that it's putting people on the brink of choosing between lives and livelihoods. And that's unfortunately unacceptable. So you should be able to have your health and to be able to go to work and have your subsistence as well. So I think the point right now is to find the right balance in applying the rules that are needed to ensure that distancing, that physical distancing, which is crucial for avoiding transmission with SARS-CoV-2, while at the same time not impacting on livelihoods in a way which is not sustainable.
Yeah, going back to that chopping and changing, Flavia, is it that sort of demoralizing nature of, oh, we don't know what's going to happen next that has led to the street protests that we've seen in Italy?
Well, it's not so much about the uncertainties. And now an epidemic like this has its evolutions. And we had already published in August scenarios that are very close to what actually happened. So the narrative that there could be a resurgence in the fall and in the winter was something which was widely discussed before. The feeling is, however, that concerns were more about the impact on those measures on sustenance in terms of salaries, in terms of workplaces. So that for this reason, right now, the government has set up a number of actions to support, in particular, those work categories that were most hardly hit by the rules that were stepped up again last week. So basically, the issue here wasn't so much about the pandemic being unpredictable. I think, in a way, there is a sense of sadness that it has started again. And of course, we would all like to be out of this right at this stage right now.
Yeah.
But there's also about a concern about what this will mean in terms of getting to the end of the month with the bills to pay. So it's also
Yeah,
a
and
very practical concern.
I'm also wondering about the circular nature of this disease. Lombardy, north of Italy, really badly hit at the start. Massive restrictions placed on whether you could even leave the town or village in which you were living. The prevalence of the disease dropped massively. Now it is back again in that area, and nobody knows when this is going to end.
I think the general perspective is that once there'll be an effective vaccination, maybe more than one, then at that point you can start with prevention strategies which can complement those known pharmacological measures that are already in place. So the expectation is that as more tools become available, and I'm talking of vaccines, but I'm also talking of more effective drugs, then our ability on a way to prevent disease, but also to mitigate the impact of that disease and how much it takes in terms of, for example, toll on hospital beds, that will change as well. So the idea now is to try to maintain the level of attention, the level of awareness that this is an acute phase of the disease, and we really do have to pay attention to the number of contacts we have every day, in addition to what is part of the regulations. As you said before with a colleague from Sweden, it's also about our own capacity to assess risk, our own behaviors, and what we choose to do every day that has a huge impact on transmission.
Okay, I just want to ask you very quickly, is there one thing that Italy has got either spectacularly right or wrong?
That's a very good question. I think one thing that was right at the beginning was to act fast. So that was needed. It was a harsh measure. It had a tremendous impact, but it was necessary at that time. Looking back, how we will look at the second surge and how we reacted to that, I think that's early to say. And I think it will be very, very useful to have some proper interaction in action reviews or after action reviews, both nationally and as a region, to look back and say, what have we done well now? What could we have done better, and how we can improve tomorrow?
I very much appreciated. That's Dr. Flavia Riccardo talking to us from Rome.
Thank you.
Well, so far we have been to Stockholm, we then moved on to Rome, and now we travel to Brittany in northern France, where we welcome Viviane Kovess-Masfety, Professor of Public Health and a psychiatrist at Paris Descartes University. In a short while, we'll be off to London to talk to somebody from the London School of Hygiene and Tropical Medicine. Viviane, jolly good to have you on the programme. How do France's controls differ now to how they did at the very beginning of the pandemic?
So actually, as you know, the data are not good. I mean, they are not good for nobody in Europe. So they are very bad for France as well. And as you know, we reconfine, but we do that in a more open way than the previous confinement. There is a lot of differences. And thanks to these differences, I think people will accept it much better.
Give us a couple of examples, if you would, of where it's not quite as strict as it once was.
Okay, of course, the main example is that the children will continue to go to school, whereas in the previous confinement they were not allowed. And this this brought in a lot of problems because, you know, even so you ask the parents to continue to work in a remote manner, if you have the children around, is very, very difficult. In addition to that, the primary school were really not prepared to do some good remote teaching. So it was really an enormous problem. So the fact that the children continue to go to school make a huge difference. I will say it's the main difference, and it matters.
I'm going to go to the UK after I've spoken to you, and there will be several points that I'm going to bring up. I'd like to put them to you. In the United Kingdom, it has been said that the number of deaths this time around in the second wave could be far worse than they were in the initial period. Is that the same fear in France?
Yes, that's true. I think nobody knows exactly why. It could be that in the second wave, the virus is stronger, which was forecast. I mean, when epidemiologists were talking about, it was clear that it will be different waves. And some of the epidemiologists already predicted that the second may be more severe, that has been described in many other epidemics.
And in terms of the capacity of the French health service to cope, more capable now than at the very beginning?
I think the main difference, first of all, is that we know better. We know better how to avoid to put the people on respiratory assistance. So most of the people, they will receive corticoid and oxygen, but they do not have to be on respiratory assistance, and it makes a lot of difference because it means that those people could be in a normal beds, I mean, more or less, with less specialized people around them. So it's open the game. And that's make a lot of difference, certainly.
You're also a psychiatrist, Viviane. Therefore, you look at people's mental condition. And I wonder how the people of France, look, I know it's difficult to generalize, are actually coping with the twin horrors of the number of headline terror attacks that there have been and the pandemic.
It's true that in the cities you have more terrorist attacks within the rural places, and same apply to epidemics. You know, for example, personally, I am in a village where there is no new case for months, whereas I came from Paris when it was thousands of cases. So, you know, your situation is completely different according to the place you are living, but I guess it's the same in England.
No, I understand that. It's all very different for every single person. Would you say there is one thing that France has done particularly well?
You know, on the beginning, I was not so happy with France in the sense that it's not so much the question of the decisions that were made, is that in France, everybody has an opinion. So you say right, they say we should go left, you say in front, we should go below. I mean, you know, everybody has an opinion and everybody is criticizing what the government do, whatever it will do. So, what was also very impressive was false ideas that you have people who decide that to wear a mask doesn't mean anything, and they persuaded they do not have the COVID. I mean, there is a lot of very bizarre things, but ultimately, when you look at the situation, it's very true that not everybody in France will wear properly a mask, but roughly they will follow confinement. And
Yeah,
we do
so
not have violent protests such as in Spain or Italy.
perhaps there's no pleasing anybody in any country. Viviane, thank you very much indeed for coming on Roundtable. And now to London. Mishal Khan joins us, Associate Professor of Health Policy and Systems at the London School of Hygiene and Tropical Medicine. Mishal, good to welcome you back to Roundtable. Last time we were talking about the possibility of a pandemic, and now it is with us. Has the UK got it right in any way?
Many ways not, but I would say the economic sort of rescue package and the speed at which that was brought in is really critical in any pandemic. So talk about a furlough scheme, etc. I think that was hugely beneficial to a lot of people.
In terms of locking down the country 4 or 5 months initially, but now only 4 weeks, possibly, in your opinion, will that work?
It really depends how we use this 4 weeks, and for that, a critical aspect is strengthening the test and trace system. So, that's going to be critical. In my personal opinion, 4 weeks, it would be great. I wouldn't be surprised if it's extended though. But as I said, it's not about 4 weeks. Isn't going to do any magic unless we build some of the systems that need to be strengthened while people are mixing about less.
Yeah, so many promises made at the start of this and throughout, one of which was, as you mentioned, test and trace, or track and trace. And we've been told it's going to be there and it's going to be working for such a long time. Is it really the silver bullet to solve it all?
It's not going to, well, it won't do it alone, but I think without it, it's really, really difficult. I mean, it is the backbone of sort of epidemic control. In addition to that, having better border control measures in terms of identifying cases there. We've not been doing a very good job there, and perhaps that will change too. That's also a critical element. And then the third thing is what I said first, which is that people who do need to isolate because they've been in contact or are indeed symptomatic, there need to be benefits in place and financial protection so that people do voluntarily come forward to be tested or say that they need to isolate. If people are losing income and they can't stay at home, then that's not a feasible way to control cases rising either.
What is the likelihood, in your opinion, of, as the Prime Minister has intimated, the number of deaths in the second wave being higher than they were in the first wave?
It seems from the prediction that is a real possibility and very scary. I would say, though, that would really, to me, be a failure, because if we think about the first wave, we had a huge number of deaths in the care homes, and there's so many lessons that could have been learned, not only from what happened here previously, but from other countries. So there's really no excuse for that. But as the closer we get to the heart of winter, the more likely that looks to be a possibility.
I know you're from the School of Hygiene and Tropical Medicine, but what about it when it comes to the School of Persuasion? Why have the British people seemingly been difficult, do you think, to persuade and allowed a second wave to come along?
I would say that although there's been a lot of messaging targeted towards individual behavior, a lot of it does come down to having stronger systems. That said, the other thing is the communication and the mixed messages. So I know that people find it confusing that university students can be together in lecture theatres but can't go out together afterwards, or people can have their kids go to nursery school but they can't meet those same children outside of school to play. So the messages have been confusing to people, and then of course they've seen some of the politicians breaking rules themselves. So I think all of this has led to both a lack of trust and also clarity on exactly not what's needed to be done in terms of the rules this time, but what's actually really making sense.
We're coming around to the turn of the year, and it was February when this first started to show itself, certainly in terms of what I was aware of in the United Kingdom. What would you say the biggest lesson that has been learned since that month, from that day to this, has been for the United Kingdom?
The biggest lesson for me, and I hope for others, has been that the UK isn't able to work without learning lessons from other countries. In March, when Jenny Harries was asked about the UK's track and trace or test and trace system, the answer was that the UK's well-developed public health system doesn't need this, and that was, of course, completely incorrect. And had we learned from other countries, we wouldn't be in this position now. So it's still not too late to do that. There's a lot of countries that have been very successful.
Mishal Khan, thank you so much. Good to have you back on Roundtable. Thank you for joining us, and thank you wherever you happen to have been watching this selection of views from around the European continent, from Sweden, from Rome, from northern France, and from London. Much appreciated the time of all of our experts. We hope to have your company wherever you're watching this next time. Until then, from me, David Foster, goodbye.